Good morning. My name is John Faulkner, and I am here with Dr. Shivam Dubey. He is a Harvard-trained board-certified psychiatrist and a visionary founder of the Mental Health Education Inc. He's also pioneering work in transforming how communities understand and support mental wellness education, advocacy, and resilience building programs. Thank you. Welcome to the podcast, Dr. Dubey.
Thank you, John, for inviting me and giving me this opportunity to talk to your audience. It's really my honor to be here.
Well, we're honored to have you. Thank you for your time today. Really appreciate it. And just to start us off, would you mind just kind of sharing a bit about your role and how it fits into like the bigger picture in your businesses and like how does that work?
Yes, so I'm a psychiatrist and I practice medicine. I did my medical school in India and then did residency at Harvard Medical School, and then I've been practicing as a psychiatrist. Uh, while I was practicing the psychiatrist, I felt there is a big need for education because without education, people when they end up in stress, we all have stress at some point of our lives, right? The stress, there is a journey from stress to disease that nobody's talking about. There is a possibility that we stop the stress somewhere. There are a lot of points where we can stop it and don't let it actually manifest as disease. The disease could manifest due to biological reasons, psychological reasons, social reasons. There are multiple factors. Even if you have biological factors, you could still stop it at some point before it manifests in full blown depression, anxiety, schizophrenia, whatever. you know there are research done which shows that there are evidence based practices, skills that if you teach formally, uh, chances that people may not manifest, or even if they manifest, they will be able to manage it better. So the time has come with this epidemic of mental health and all that, that we need to teach these skills to the population formally. So basically what is happening is, like, if there is a disease in the community, the government fortifies. Like if there's a deficiency of vitamin D, the government will put the vitamin D in milk. In India, there is a deficiency of iodine, so they iodize the salt. Similarly, the time has come that we need to fortify our education with mental health education.
Yes.
So that is what I started doing while practicing psychiatrist. And actually, when I was practicing psychiatry, I was seeing a lot of pathology. I was seeing depression, anxiety. I Sickest of the sick will come to me. Nobody wants to see a psychiatrist, I'm telling you, okay? Right? It takes a lot to see a psychiatrist. So by the time they reach me, they have already gone through a lot. Like they may have seen a primary care doctor, attended therapist, and all that. And when they come to me, they already manifested the disease. But I don't know why I just have this passion and this vision that I could intervene before they come to me.
Yeah. Yeah, you're trying to find that place to kind of like be more proactive about it in your approach is what you're looking for. Sounds like
Yes.
so.
Well, that's how it works. In if you see all the diseases like cardiac health, stroke, breast cancer, there is an awareness program for that. For cardiac health, you are actually educated that you should exercise, do cardio, this much. Everybody goes to gym and do it, right? Similarly, for stroke and all other diseases. And for infectious disease, we have vaccination program. A child is born and they are given a vaccination for diphtheria, pertussis, tetanus. What is the risk of a diphtheria and what is the risk of a depression? The depression risk is much more. So we need to start doing some preventive programs. Not just awareness is one thing, but actually giving them skills, like they give vaccination so that they know how to deal with it when the stress arrives, or if their biology manifests, then what can they do? That's how we control the epidemic in the for any disease. Primary prevention, secondary prevention, tertiary prevention. So primary prevention is before even the disease has started. Secondary prevention is that you screen awareness. What are the symptoms of depression? What are the symptoms of anxiety? So if you get them, you go and get early diagnosis and treatment. That is secondary prevention. I think we are more focused on secondary prevention. We are teaching everybody to find the symptoms of ADHD. So teacher will know, oh, this kid has ADHD. Everybody is taught to find the pathology actually. Screen for the pathology, find it and treat it. That is what I think the whole world is focused on. And it's very important part. I mean, we don't want to, because it's going to get worse if we don't catch it early and treat it. So that is a very important part. But that is something that when the crisis is already happening or have happened, we need to act before the crisis happens. So that is primary prevention. So the primary prevention is a little lacking, and I think that is what we want to do. And primary prevention is just not awareness; it's basically teaching those skills, and that is what we have created with our mental health education curriculum. We have created a formal education program that people can learn the skills of positivity, self awareness, self management, relationship skills, responsible decision making, cognitive skills, resiliency. We teach them formally so that this disease doesn't even manifest.
That's wonderful. Really spearheading that effort too. Like think having like a new perspective. It seems so like logical and simple, but I think it's just and that's it's just been obviously missed. We're always thinking about what's happening in the moment, almost like putting the fires out per se. So yeah, thank you for sharing that. And then is your like kind of working day to day, like what does that look like for you in your role?
Well, I practice psychiatry still full time. So I see patients all day and I prescribe them medications because most of the time when patients come to me, they have already crossed those bridges of therapy and primary care. So when the time they come to me, they're most likely needing medication. Their biology has manifested, or even if they did not have a biological disorder, but the stress that, like I told you, there's a journey from stress to disease. They have crossed the stress, they have continued to be in stress, chronic stress, that their neurocircuits have changed, their behaviors, they react, their physiology is acting out, they are having heart race, they are having overthinking, their thoughts are racing, they are not able to sleep, they're not able to take decision, they are exhausted, overwhelmed. And at that time we need some chemical, like medications, to help them calm down. Their limbic system, there are three parts in the brain mainly that we talk about: prefrontal cortex, which is your logical brain, and limbic system, which is your emotional brain, and brain stem, which is your reactive brain, impulsive brain. By the time they come to me, their limbic system and brainstem is acting out, and they can't think logically. Their prefrontal cortex is shut. There is a relationship between limbic system and prefrontal cortex. If limbic system is acting out, like if you're very emotional, you cannot think logically.
No.
If your prefrontal cortex is very active, your emotions will calm down. So by the time they come to me, their physiology is out there acting against them. They can't control it. So I have to give them a medication. But there is a very important piece of education when I prescribe the medication that I have to give them. And I feel like not many doctors are doing it, and they should be doing. That's why we have a mental health education program for doctors also, that when you prescribe a medication like a antidepressant, anti-anxiety, like SSRI kind of medications, these medications calm down your limbic system. It helps decrease the cortisol, which is overflowing in a stressed person. And when that happens, there is another thing happens, that these medications help increase BDNF, which is a neurofactor which helps increase the neuroplasticity. It makes your brain more ready to change neuroplastic. So at that time when you prescribe the medication, if you did not tell your patient to change the patterns of thinking, then that person may continue to think the way he was thinking and may strengthen the old pathways. So it could be dangerous actually. If this person is very negative and all that, and this you give the medication and they keep on negative, I'm not good enough, my marriage is falling apart, I couldn't do anything. If keep thinking that, they will strengthen those neurocircuits and behaviors which is causing the problem. So it's very important at that time of the medication when you give, that you tell the patients that you have to change the way you're thinking. You have to think positive.
Yeah. It's a two-part solution.
Yeah. So that you can make new pathways. Because your brain is ready to learn. So the education is coming at every piece, even before the disease started and after disease started is imperative. It's very, very important. So that's why we try to come up with mental health education. And I'm creating a lot of different education for doctors, for healthcare providers, for parents, for professionals, and for my patients also. So
Awesome.
like I said, during the daytime, I do my practice, I see patients, pathology, try to help them with medications and education. I don't do much therapy. I send the patients for formal therapy with their therapist mainly, but I give them education. Besides that, I'm involved in my mental health education programs. We have programs in schools where we introduce a formal subject of mental health education. So, mental health education is not like a random class your teachers gave in your school, like it happens in America. The social emotional learning programs are going on in schools where teachers come and teach you one random topic, like mindfulness, resiliency, and all that. We have a formal curriculum where you will be given a book. Your teachers will be trained in the school. Every week, a teacher will come and teach you one chapter. After every 6 chapters, you will have an assessment. It will assess you on 5 competencies: self awareness, self management, relationship skills, responsible decision making, and social awareness. So it's like a formal subject like mathematics, geography. It's not like just random. So we created like whole curriculum from first grade to 12th grade. We have age appropriate books, and the books are filled of neuroscience concepts. All these brain things that I'm talking about is all taught to our kids. And sometimes I feel when I kids will graduate, they will be like half therapists.
That's probably very true. Yeah. I was going to say they self-actualize to the point of they
Yeah.
just
One
understand.
thing I also want to point out, John, here is that our curriculum is different from our curriculum in a way because we are based on neuroscience and evidence-based practices. Not only that, we also believe in experiential learning, self-reflection, insight. Our education, our chapters are designed this way that they create insight in you, self-reflection in you. The human beings are thinkers. They can think for themselves and others, different from animals. And one great thing that we have got is self reflection. If we stop self reflecting, how will we find out what are our weaknesses? What are our strengths? How will we improve ourselves? How will the human consciousness will evolve if we stop self reflecting? What is happening is that most of the things are making you impulsive. The whole world is attacking on your 5 senses. They're trying to sell something for your smelling, for food, for ears, music, for eyes. They are consumerism. Basically, the whole corporate and everything, they're trying to sell you something for all of your senses. And that is making you more impulsive, less think self reflective. And when you are not reflecting on yourself, how will you evolve? How will you improve? So this our curriculum is designed in a way every chapter that a teacher teaches is not just one way. It's like teacher will talk about a concept and the whole class will discuss on it. They will ask why, what if that, what is this, why do we do this, they ask questions, and that makes the student think. It create a curiosity, and that can lead them into self realization, actually, that they understand who they are.
Yeah.
you know that
That's
is
a
very important.
Yeah, it's very important and kind of leads into like my next question too. Kind of alluded to it already. Like what are like the major shifts that you're seeing in your industry right now?
Yeah, in our industry, in educational industry, see, there's my industry. There are two industries I'm dealing with, right? One is the treatment industry where I prescribe medications. New medications are coming. Clinical practices, inpatient hospitals. I go and round there. So there's a whole pharmaceutical industry where they are making new and new medications. New research is going on, and the way the doctors are practicing. Psychiatry is a big boom right now, and it helping people to they can get treatment at their home. So that is one industry. The other industry is educational industry. So now they already have all these subjects, mathematics, geography. Now we are trying to introduce our subject, which is mental health education. So when we go, there's a lot of stigma about it. They don't want to talk about mental health. So our it's not mental. Why are you giving them mental health education? I say, look at the definition of mental health by CDC and WHO. If you look at the definition of mental health on the website of CDC's WHO, is that mental health is how to stay healthy mentally so that you can survive in the community with this, deal with the stress, manage the stress, and remain functional. That is mental health, so that you don't get stressed or you don't get disease and you stay functional. That is mental health. So who is teaching that? Treating it is just one aspect of it. Who is teaching them? So the mental health education is how to stay mentally healthy and be functional in the community. See, the whole thing is if we become human beings become dysfunctional, that is a big economic load on the society. Not only economic, if human beings become disabled for mental reasons, it causes a social problems, psychological problems, all kinds of problems it causes. A lot of people homeless have mental health problems. So when you are disabled from mental health problems, you create a big homeless population. I mean, that's not the only factor of homelessness, but I'm telling you, there are a lot of
Major
people who
factor.
are homeless are have mental health problems some kind. Then drug use, addiction is another comorbidity that happens with mental health. A lot of people who have addiction, they have comorbid mental health problems. Because a lot of people end up getting addicted because their mental health is not taken care of. They use these substances, and then so there is, if you look at the dollar amount that we are spending on homeless and for addictions and for criminals, a lot of criminals have mental health problems too. It's a big amount of money. I think some of that amount of money should come to mental health education so that we don't even go there.
Yeah.
That we can. So this industry is very difficult to, I'm having really difficult time engaging the school. And because when we implement our subject in a school, it's a very difficult thing, because it's not only we just put a subject, it's like whole school changes, because we train the teachers. There is a new subject in their schedule for each classroom. Every week they have a new class for mental health education. Then they have assessment. Then their report card is also reflecting their assessment.
Interesting. Okay.
So
So you have
when they
metrics like built into the curriculum.
yeah, the
Okay.
whole thing has to be added to the school. So the school has to do a lot of work. So when we go to school, principals, they say, oh my God, we are already overwhelmed. Our teachers are already doing so much. And you
Yeah.
want another subject to be added. Just imagine the school teachers, how they're angry they are, but they're not actually. They love it, because when they teach the mental health, their mental health improves. And then when they go home, they start doing better in their lives, their children, their husband, their families, and the whole community. So every teacher we train, we have trained more than 500 teachers. Every teacher we train, not only they help the school, but they help the community.
It's a transformation.
Yeah, so it's a big impact that we are creating with implementing any the subject in school. So that program is going very well so far. I mean, we have 30 schools in India, and we just got a school in UAE, and we have more than 30,000 children, and we are trying really hard to get into Europe, Australia, Singapore, and America. That is our next destination. We just presented our program to a country in Central America, in Belize. We are waiting to hear from them. And this curriculum was actually made for America, but I ended up launching it in India.
India.
Yes, but our next goal is to launch it in America, Europe, Australia, and Singapore. That is our next destination. I definitely want to take this program to Middle East and Africa. Uh, you know, I think this is like a basic human right to
Yeah.
have mental health education.
I was gonna say, yeah, it's not just localized to a certain geography. It's really a worldwide
Yeah, or it's like
transformation. Yeah.
yeah, it's like skills that needs to be taught. It's just the time is there. The time has come that we have to you know think seriously about it.
Yeah. And then you've already kind of spoken about, what's working well for you, what's been frustrating. I've heard those points discussed. It sounds like you're also getting more focused on like metrics. So like I heard some of the metrics, like what metrics do you use like in your own growth of your business? What are you like really getting focused on to improve?
Yeah, so basically our program, like it's a very experiential, and we try to do a lot of workshops in
Yeah.
schools and other places to make the people actually feel it. We don't want to increase their knowledge box that just keep putting more and more information in their brain. We don't just want that. We want them to feel it, experience it. That is our take, because if you introduce a new thing into any system, you have to make people feel about it.
Yeah.
They should have it, not only just knowledge. I mean, it looks good, but when they feel it, then they are invested with us. So to get into the market and grow the market, we have to create interventions and modalities. So we have a mobile app. We have mobile app for children. So whole curriculum is also on a mobile app because we have to use the technology. So technology is a big thing, like you said, to grow the business. I mean, the technology is right now, you cannot stay behind. So we have a mobile app for school program, and we also have a mobile app for adults, which is AI enabled, where we teach adults a mental health education curriculum called Mighty Champions of Mental Health. So I think the main things we are using, technology we are using, and the workshops we are doing, and try to make them more and more experiential and, have people get a feel about it.
Yeah.
Yeah,
You get
that
that
is,
feeling of what you're doing to get your message across because it's hard to do that.
yeah, because it's a new thing. So you are introducing something which is not there.
Right.
So first you have to have people feel a need of it. You have to justify why is it needed, and then you have to give them the solution, and then you have to make them feel that there's a value to it, and all those kind of business. I'm actually not a very good businessman. I'm telling you, I'm not. I'm very passionate, emotional, and I think that's a strength too, because with that passion and emotion, I was able to reach here.
Yeah.
But my partner in this crime, whatever you say, in this whole thing is my brother,
Mm.
Manas Dubey, and he's located in India. He is a businessman.
Yeah.
He's running the whole business, and he was able to convert my concepts into actual business. Where we were going to school, we created business model, we have affiliates, we have ambassadors, mental health ambassadors so every school we go in, there is always an ambassador who is
Yeah.
connected to the school, and that person is something where who is very close to school, is a volunteer or somebody like that, and they keep the connection between school and us strong. So get the feedback. It's very important to get the feedback from your consumers, and improve your product day and day. So we have the next curriculum, we are having the MindSync 2.0 is coming, because we
Sick.
have to, things are changing very fast. So we are upgrading our education with the latest research. So it's a lot of work. We already have the curriculum. Now we are upgrading it to 2.0. And then we have to change it in an app and all that. So that's a lot of work.
Yeah. It sounds like a lot of work. And it's
Yeah.
changing quickly too from what you're doing.
Yes, it is changing very quickly, and but we see that there is a lot of acceptance also. A lot of people who are positive, they understand us. The only thing is that who will do the work, when it comes to, so we will do the work. We do everything they require. We solve their problems. We remove the obstacles they have in implementing the program in schools. Wherever we go, we try to figure out what are the problems or hesitation or obstacles they have, and we try to work around it. We have a team of psychologists who are clinical psychologists, but they have changed their directions, and now they are working as mental health educators. And you, someday, if you get to talk to them, you will be like blown away, that because whenever you go to a psychology program like PhD and master in psychology, you want to sit and do therapy. That's your dream. Oh, I want to be a therapist, like, talking to people. But now we have these psychologists who are not, they do therapy a little bit, but they are changed into an educator. They're going teaching teachers and school kids. So that's another thing we have created, mental health educators.
You have like a team of people that are helping you implement. It sounds like you're
Yeah, we
training.
have like around 20 psychologists all over the
Pretty
world.
big.
We have
Yeah.
psychologists in Canada, Australia, France, UK, India, Pakistan, and America. And then we are all, it's a global, we are trying to run it globally. And all these psychologists are master's level psychologists, and they are all, our employees basically. And then they are working for us day and night for curriculum and create program implementation, teaching, and everything they are doing.
Excellent. Yeah. This
And
sounds
then
like
yeah, there is, sorry to interrupt you, but there is another thing we are doing is research. We have
sure.
a whole research program that I'll tell you later. Yeah.
Yeah, that's great to hear. It sounds like you have an app, the MindSync app. You're on a 2.0 version, which is exciting. Sounds like you're growing potentially in other markets, which is awesome, amazing. Yeah, if there's one major challenge you can solve with a magic wand,
Okay.
what would it be? Yeah.
Well, you know what? I really live very close to Harry Potter Universal Studio, like 10 minutes from there. And I take my son there and he buys all kinds of Harry Potter. And he plays this game, he freezes me. Freeze! You know what? If I have to do something, I'll freeze everybody, the whole world. Pause. We are just running, running, running without even knowing what we are doing. We just run by this whole corporation world. We don't know what we are doing. Sometimes we just running. We're so busy. We don't have time to think what we are doing. We don't take pause. We just So I will take that magic band and freeze everybody and have them take a pause, take a
Pause.
deep breath
Yeah.
and self reflect, develop insight. What do you want to do? What are you doing? Why is that? What is it? And I think if the whole world pauses for, let's say, 5 minutes and start reflecting on themselves, think about what they're doing and ask few questions, I think that could do a big impact and change just then having them, a self reflection or mindfulness moment. I think that will I do with this magic band you give me.
No, I think that would be amazing for everyone just to pause and think about what they're doing. Before we wrap up too, you were talking about, you wanted to mention research. So I want to make sure we covered that before we end it for today.
Yes, so research is a very, very important piece of mental health education because what is happening, there is a lot of research, but it has not been put forward. We are not talking about it. If there is a new medication coming in the market and you put it on LinkedIn, everybody's, oh, there's new medication. Oh, there's a new medication. It's all treatment. But if there is a new strategy coming for mental health education, nobody or a research coming that if you teach this will happen. That is not very. So that is what we are trying to do. We are putting research. We have right now 20 doctors from all over the world, medical doctors, who are doing research. We just published a research paper yesterday, and they are working really hard to publish the research in journals on mental health education. So we implemented our program in school like a subject. Kids were evaluated pre and post. We looked at the data and then we published the research. What is the mental health education has impacted in their life? For teachers, we have program for doctors. The doctors did the mental health educations. We're publishing research on what impacted the doctors have by learning mental health education skills and with the burnout. So all this research we are compiling and publishing in journals, going to present and give presentations and conferences and all that. So that is a big piece that we are doing to increase the awareness of mental health education and importance of it.
Well, that's amazing. So that's it's exciting because you're actively doing the work, but you're also doing a lot of research to continue it, to keep it going, to keep the ball rolling in a sense, right?
Yes.
So that's exciting to hear as well. But yeah, thank you for joining us today, and I truly appreciate your time, and I'm sure our viewers will as well. So thank you very much.
Thank you, John, for giving me the opportunity to talk about mental health education. And I welcome you to look at our website and our programs. And thanks again for giving me the opportunity.
Absolutely.